Hi, today we are going to discuss about mumps. I'm Mrs. Jansi, clinical instructor working at M College of Nursing. The objectives for today is at the end of listening to the session, the listener will be able to define mumps, mention the causes, discuss its transmission, brief the signs and symptoms, list the complications, enumerate its prevention. Introduction. Mumps is an illness caused by a virus. It usually affects the glands on each side of the face. These glands are called parotid glands, which produce saliva. The swollen glands may be tender or painful. Definition. Mumps is a contagious viral infection that causes the swelling of the salivary glands, primarily affecting the parotid salivary glands. It is also known as viral parotitis. You can see here, this is the affected parotid gland. What is a causative agent? That is paramyxoviridae, also known as mumps virus. What is a transmission? Mumps is a contagious disease caused by a virus. It spreads through the direct contact with the saliva or respiratory droplets from mouth, nose, or throat. An infected person can spread mumps from a few days before the salivary glands begin to swell up to 5 days after the swelling begins. Excreted through the saliva, nasal, and urinary excretions. This is about the transmission. What are the risk factors? Unvaccinated individuals, international tourists are affected, pregnant mothers, the people who are living at the overcrowded area. So what are the symptoms of mumps? So first is fever, loss of appetite, headache, muscle ache, pain while eating, pain in the jaws, ears, and chin, pain on both the sides of the jaws. So these are the symptoms of mumps. How could you diagnose? History collection and by physical examination, followed by clinical diagnosis through blood, urine, and saliva samples to confirm the diagnosis. CSF in severe cases to test for meningitis. Serum and urinary amylase can be done. That will be usually raised during the first week of parotitis infection. Serology, presence of IgG, immunoglobulin will be there, and rise in IgG titer for more than 4 times, which indicates the recent infection, and presence of IgM. What are the complications? Complications of mumps include orchitis, that is painful and tender testis. You can see here painful and tender testis. Oophorytis in girls and in women. Pancreatitis, encephalitis, meningitis, thyroiditis, myocarditis, nephritis, arthritis, and hearing loss. So these are the major complications of mumps. What are the conservative measures? That is treatment, which includes adequate fluids intake, bed rest, hot or cold compress over the parotid area to relieve from pain. Analgesics and antipyretics can be given. Aspirin containing medications should be avoided. Avoid food which encourages salivary flow. That acid foods, fruit juices, and spicy foods can be avoided. Soft or liquids can be given as chewing may aggravate the pain. Most people recover from mumps within 2 weeks of time. So within that time, the conservative measures can be followed. How could you prevent mumps? Avoid sharing utensils and drinks. Cover your mouth when sneezing or coughing. Practice good hand hygiene. Clean and disinfect the surfaces. Infants should be vaccinated within 15 months of time. And then older children, adolescents, and adults not protected by MMR should receive monoclonal mumps or MMR vaccine at the earliest. So these are some of the references. Hope you understood the topic. Thank you.